Hello, good evening to everyone and welcome back to the channel The Upcoming Doctors. So in this session we are going to discuss the part 2 language of anatomy. So let us get started. So here in this diagram we are seeing the different movements of the upper limb. We can start with the flexion, which means the arm is present and the forearm is present. So decrease in the angle in between the arm and the forearm. The flexor surfaces comes in opposition, that is called the flexion of the upper limb. I mean flexion at the elbow joint. Okay, this is the elbow joint and flexion is occurring at the elbow joint. And coming to the extension, the straightening, increasing the joint angle is called extension. We can see it is around 180-degree angle. So this is the extension. Okay. And coming to the abduction, that is moving away from the midline. This is the abduction. Okay. And adding to the body, that is addition to the body, like adduction. Okay. Coming towards the midline of the body. And this is the circumduction, moving in a circular manner, right? This moving in a circular manner, that is called circumduction. And the last one, that is pronation and the supination. Pronation means turning downwards. I already said, remember, like P and P, P for promise and P for pronation. We normally promise in that manner, the palm will faces downwards, and this process, I mean this position, is called the pronation. And the supination or the supine position, nothing but turning the palm upwards. Okay, the palm will be facing upwards. These are the movements of the upper limb. Okay, and then here we can see again in this picture, abduction away from the midline. This is the midline, right? Abduction means away, B and D, no? That's why remember like this, abduction, away from the midline. So these fingers are abducting, and here towards the midline it is coming like this. So adduction of the fingers. Okay. And next one is the opposition of the thumb. So we can see here the tip of the thumb, right? The tip of the thumb is touching the tips of other fingers. So this is called the opposition of the thumb. This is all about the upper limb. Now we can start with the lower limb. And coming with the lower limb movements, we have the flexion of the thigh, right? Thigh portion is present. When the front of the thigh comes in contact with the front of the abdomen, this position is called flexion of the thigh. An extension of thigh, whenever the person stands, normally we stand erect and straight, that position is called the extension of thigh. And coming to the abduction, it is always the thigh is taken away from the median plane, I mean midline, and midline of the body, that is a median plane or the mid sagittal plane, no? And adduction means adding to the body, like that you can remember, when the thigh is brought close to the median plane. And the same terms like medial rotation and lateral rotation, whenever the thigh is turned medially, that is called medial rotation. When the thigh is turned laterally, that position is called lateral rotation. And coming to the thigh is finished, and coming to the knee joint, okay, the flexion of knee, whenever the back of the thigh, assume that back of the thigh and back of the leg are coming in opposition, this position is called flexion of the knee. And the extension, again, when we in the straight line, like when we standing position, on the standing position, the thigh and the leg will be in the straight line, that position is called extension of knee. These are the movements of the lower limb. And coming to the foot, we have mainly, these are very important movements. Remember each and every movement of the foot, like dorsiflexion, plantar flexion, inversion and eversion of the foot. Now let us discuss in detail. The dorsiflexion means dorsum foot will be consisting of two, okay, I mean two places, like dorsum of the foot will be present, sole of the foot will be present, and the brought closely to the front of the leg. Okay, this dorsum of the foot is brought closely to the front of the leg. Okay, dorsum of the foot is almost like similar to the dorsum of the hand, and sole of the foot is similar to the palmar surface of the hand. Okay, so that you can compare. The sole of the foot will faces forwards in this dorsiflexion. Remember, the sole of the foot will faces forwards. And coming to the plantar flexion, the sole of the foot, or it is otherwise called the plantar aspect of the foot. Okay, it will faces backwards. In the dorsiflexion, the sole of the foot will faces forwards, and the plantar flexion, the plantar aspect of the foot will faces backwards. And coming to the other two movements, these are the inversion and the eversion movements. Inversion means into the, I mean inside, okay, coming inside, like medial border of the foot. Again, foot will be consisting of two, okay, the medial border and the lateral border. Again, the medial border means which is near to the midline of the body, and the lateral border means which is away from the midline of the body, like whatever the little finger will come, no, little toe, that's called lateral border of the foot. Okay, so the inversion and the eversion are the two movements of the foot. The medial border of the foot is raised from the ground, that is called inversion. In eversion means like away from the body, you can remember like this, lateral border is raised. Dorsiflexion, plantar flexion, inversion, eversion, these are the four movements of the foot. And mainly, what is the difference between the dorsiflexion and the plantar flexion? The dorsiflexion means the sole of the foot will face us forwards. In the plantar flexion, the plantar aspect or the sole of the foot will face us backwards. And coming to the other two movements, the inversion and the aversion. Inversion means the medial border, okay, not middle, medial border, which is like just nearby the middle or the midline of the body. So the medial border of the foot is raised from the ground, and aversion means the lateral border is raised from the ground. These are the main differences and the movements of the foot. We can see in the diagrams also in coming slides. And this is the another movements for the neck. Okay, neck also will have some movements, no, that's we can see here. The neck will have flexion, extension, lateral rotation, and very important movements that are the protraction and retraction. Come, let us see. The flexion means whenever the face comes closer to the chest region, that is called flexion. And extension means like we are standing erect and when the face is brought away from the chest. Okay, here we are taking chest as the reference. So whenever comes closer to the chest, it is called flexion. Decreasing the angle in between the face and the chest, and increasing the angle in between the face and the chest means extension. Nothing but face is brought away from the chest. Coming to the lateral rotation, when the ear is brought close to the shoulder. Remember this, whenever the ear is brought somewhat closer to the shoulder, which means moving our head, turning our head like medial to lateral side. Okay, that is called lateral rotation. And coming to the main important movements, that one is a protraction and retraction. What do you mean by the protraction? We know we have the upper jaw and the lower jaw, and upper jaw is immovable and the lower jaw is movable. So whenever this movements, protraction and the retraction are related exactly to the lower jaw. So whenever the lower jaw will slide forwards in its sockets in the temporal bone of the skull. You remember this, the lower jaw will slide forwards, that is called protraction. Again it comes back to the position and it slides backwards. Then backwards means it is called retraction, okay, in its socket in the temporal bone of the skull. Which bone means it is related to the temporal bone. Remember this, very important movements. There are two movements related to the neck, which means literally to the mandible. Talking to the mandible bone will be present in the lower jaw. So the protraction means whenever the lower jaw slides forwards in the sockets, whenever lower jaw will slide forward, that is called protraction. When the lower jaw slides backwards, that is called retraction. This is all about the neck movements. And coming to the trunk movement, okay, trunk will be present. Now that trunk movement, we have normal movements, that is extension, flexion, lateral flexion and the lateral rotation. So backward bending of the body, this is called extension, and forward bending of the body, this is called flexion of the trunk, and sideward movement is called lateral flexion, sideward rotation is called lateral rotation. Okay, let us see in the diagrams what are all these movements related actually. Okay, so this is the diagram which is relating the lower limb movements. Okay, here we can see this is the medial rotation, which means somewhat turning toward the medial line, and this is the lateral rotation, turning away from the medial line. Here you can see this foot, okay, I mean foot we can see, and we can say the medial rotation and the lateral rotation is going on. And here the aversion, already told that foot is somewhat turning outward, and inversion, the medial border. So here you can see the foot, this is the foot now. So we have dorsum, this is the dorsum of the foot, and the other side will be the sole of the foot. So this is the medial border of the foot, okay, and this is the lateral border of the foot. Remember this, whatever the big toe will be present, no, this is called medial border, which means towards the midline. Okay, it is present near towards the midline. So this is the medial border of the foot, and the little toe is present, no, that is called the fifth digit. It is called the lateral border of the foot. This is very important. The foot means you should remember two surfaces, which means the dorsum of the foot will be present, other side will be the sole of the foot, and two borders are present. One is the medial border, wherever the big toe is present, that is called the medial border, and the little toe is present, that is called the lateral border of the foot. Okay, and coming to the foot movements, we can see here the dorsiflexion and the plantar flexion of the foot. Again here it is somewhat facing upwards, okay, like it is raised and facing upwards. This is called the dorsiflexion, and here facing downwards towards the ground, and this is called the plantar flexion. Okay, these all are the movements. Okay, and then here we can see the protraction and the retraction, which are related to the neck movements, mainly the temporomandibular joint. Okay, the joint involved in this protraction and the retraction movements. This can be asked as a MCQ in the protraction and the retraction movements of the neck. Okay, literally to the neck, which are of the protraction and the retraction. MCQ will be like this: protraction and the retraction movements of the mandible involve which joint? The answer is TMJ, that is the temporomandibular joint. So this is the mandible, no? This entire thing here, the mandible will be present. Okay, and so whenever it moves forwards, okay, protraction, protrudes, no, the lower jaw will move and slides forwards, means that's called protraction. Whenever it slides backwards, thus position is called retraction. This is all about the protraction and the retraction. And now, okay, these are the trunk movements: extension, flexion, lateral flexion, which are seen here. This is the extension of the body, okay, right? Bending outwards, no, that's why it is the extension, and bending forwards, this is called the flexion of the trunk, and this is the just sideward movement, that's why the lateral movement is seen, that is called lateral flexion. Okay, these are the movements of the trunk. And now remaining is the muscle and its terms. This is an extra concept you should remember, because all will be in upper limb, lower limb, abdomen, whatever the sessions will come further, all will be having this concept, that is the muscle. So it is very important to know what is the muscle and what are the related terms regarding the muscle. So origin, insertion are must and should to the muscle. So origin means like where the muscle starts, the end of the muscle which is relatively fixed. Okay, just we say relatively fixed, the origin is relatively fixed and the insertion will move. This is the basis to decide which is the origin and which is the insertion in usual manner, but there will be some exceptions also. So remember, the muscle will have origin and the insertion. So the origin means the end of the muscle which is relatively fixed during its contraction, and insertion means the end of the muscle which moves during the contraction. So origin is fixed and the insertion will move. And coming to the belly, the muscle will have the tendon, belly, all these things. So the fleshy and the contractile part of the muscle is called belly, and the fibrous, non-contractile and the cord-like part of the muscle is called tendon. Okay, belly means it will be the contractile part. You can face like this: what is the contractile part of the muscle and what is the non-contractile part of the muscle. Remember, these 2 points are very important. The belly will be the contractile part of the muscle which can takes part in the contraction of the muscle. At the same time, the tendon will be non-contractile, it doesn't participate in the contraction of the muscle. Remember this point, this is very important again. Okay, and coming to the aponeurosis, it will be the flattened tendon. You should be familiar with all these terms. Okay, and coming to the raphe, a fibrous band made up of the interdigitating fibers of the tendons. It is stretchable. Unlike the ligament, it is stretchable. The ligament and the raphe, main difference between the ligament and the raphe is the ligament is non-stretchable and the raphe is stretchable. And coming to the example, pterygomandibular raphe will be present, which is stretchable actually, okay, which can stretch. So this is all about the terms related to the muscle. It has origin, insertion, belly, tendon, aponeurosis and the raphe. I can briefly say about this. Origin means which is relatively fixed, and insertion means which is movable, okay, and participates in the like contraction will happen, and during is a contraction which is movable. And coming to the belly and the tendon, main difference, the belly is the contractile part of the muscle and tendon will doesn't takes part in the contraction of the muscle. And aponeurosis means it's a flattened tendon, and raphe and the ligament will have main difference. The raphe will be it is stretchable and ligament is non-stretchable. Okay, this is all about the muscle. So we can see one last more diagram. This is the muscle. Here shown is the biceps muscle. Okay, we can see in the arm. This bone is, yes, you are correct, this is the humerus bone. Okay, the humerus bone is also called funny bone. Okay, remember this point, this is also very important, the funny bone. Okay, but it may also ask as an MCQ, right? Which bone is called the funny bone? That is the humerus. And coming to this will be the radius and the ulna are present. So this will be the like radius and ulna are present here. Okay, radius and ulna are present. And coming to the origin, insertion, this is the belly of the muscle, right? So belly is the contractile part of the muscle, and tendon will be present. These are the tendons. Like origin will be present. Origin of two heads. Mainly the biceps has two heads. One is the long head, another one is the short head. Like origin of the short head mainly occurs from the coracoid process of the scapula, and the long head occurs from the supraglenoid tubercle of the scapula. And then insertion will be, tendon is present here and inserted into the radial tuberosity. We can discuss in further sessions what is this biceps brachii, what it will come, like origin, insertion, detail we can discuss in the other sessions. Coming to this point, we need to know that muscle consists of the origin and insertion, and tendon will be also present. The tendon is inserted into the radial tuberosity, and tendon doesn't take part in the contraction of the muscle, and belly is the contractile part which take part in the contraction of the muscle. And here the bicipital aponeurosis. Aponeurosis means what? Yes, you are correct, that is flattened tendon. Okay, this is all about the general anatomy. From to this point we completed the general anatomy and we are going to start the gross anatomy. So this is all about the part 2. So please like, share and subscribe to this channel so that I'll get confidence to do more videos. And thank you for your support. Thank you so much.